so wrong?
She's having multiple grand mal seizures. Now, how do you want to proceed? Dr. Gray, are you listening to me? She's got diazepam, 2 milligrams lorazepam. I just gave the second dose. Dr. Gray, you need to tell us what you want to do.
The good old frozen intern syndrome. Honestly though, I feel for her because when I was an intern, I've probably gone through that multiple times. But this patient is acutely presenting with seizures. What do you do? So the first things that come through my mind is there anything that provoked the seizures? Any metabolic causes, electrolyte derangements, any toxic drugs that the patient may have taken, alcohol, overdose of certain medications? Other things you want to think about are maybe some sort of symptomatic localized process, such as an acute stroke, a brain bleed, infections such as meningitis, anything structural in the brain such as tumors, maybe traumatic brain injury if they were involved in a car crash or head-to-head trauma. Oftentimes though, we're not entirely sure what causes seizures, in which we term that idiopathic. Now, other things you want to think about in a differential for seizures are syncope, TIAs, migraines, sometimes could present with seizure-like activity, panic attacks, or it could be psychogenic, although that's the last thing we ultimately want to try to rule out. Now, in terms of the workup for seizures, I definitely want to check a glucose level, CBC, CMP, maybe get an ABG. Other labs that are helpful are creatine phosphokinase, white count, LDH, lactate, which are often elevated, though these are non-specific markers. Pregnancy tests, especially if they're young female, urinalysis, urine tox screens. If they're taking any particular anti-epileptic drugs, usually you want to get the levels of those drugs to see if they're overdose or underdose. Prolactin is also a good thing to get if they're within a particular time frame, as it's often elevated, though the sensitivity of that is often 50%, so not too great. If you suspect infection, you want to get blood cultures. Imaging-wise, I would want to get an urgent CT head to rule out any masses, hemorrhage, abscesses, and usually that's followed by an MRI. MRI with contrast, especially for patients with first-time unprovoked seizures. Other things to also get once they're more stabilized are an EEG, LP to rule out infection, as I mentioned. But in general, those are the main studies you want to consider when working up a seizure.